Hi, I'm Dr. Amir, and welcome back to my medical education channel. One of the cases I saw recently, a patient complaining of a spreading rash. She thought she had insect bite. I diagnosed her with shingles, or what we call it, herpes zoster. The cause of shingles is a virus, and it's the same virus as the chickenpox, and it normally affects adults. Although it's named herpes, but it's not sexually transmitted disease. How do we get shingles? After we get chickenpox at young age, the virus becomes inactive and dormant in our nervous system. And when we get older and our immune system is down, the virus becomes active and travel down the nerves and develop shingles. So what are the symptoms of shingles? Early symptoms of shingles is a stinging or burning or even stabbing pain in one side of the body. It could happen in the chest or in the face or the leg. Sometimes the patient might have headache, fatigue, or fever. A few days later, the rash will start. It's like a blisters filled with fluid. It develops slowly and gradually will get worsened. But this rash will never cross the midline. For example, if the patient have the rash in one side, it will stop here in the middle. If it's in the face, also would not cross the other side. And the pain gradually will get worse over the next few days. Sometimes shingles is very dangerous, especially if the rash develops in the face, near the eyes or the ears. In this situation, the patient might have vision loss or hearing loss. This is very serious condition which might require hospitalization for treatment. Normally, we treat shingles with antiviral medication, which will shorten the course of the disease if it's given the first 2 days of the rash. Also, it might lessen a condition or prevent a condition called post-herpetic neuralgia. It's a chronic pain in the area of the rash, could last for a long time after the disease. And if we don't treat shingles, the rash could last 2 to 3 weeks, and the patient end up with a chronic pain for a long time or even months, which require a chronic painkillers. Is shingles contagious? Normally, shingles doesn't spread from one person to another. But the fluid in the blister, which is filled with viruses, can spread the chickenpox disease to non-immune children and non-immune pregnant women. So how do we prevent the spread? Normally, we should cover the rash and wash the hands when we touch the area. Usually, patients with shingles should avoid getting in contact with pregnant women who are not immune to chickenpox. Otherwise, a serious malformation could happen to the fetus. The good news is there is a new vaccine against shingles, and it is different from the chickenpox vaccine we give normally to children. It is normally recommended to be given to adults 60 years and older to prevent shingles. I hope I shared with you good information about shingles. Until I see you next time, I would like to wish you a happy, healthy life.